And now our regular veterinary feature. All animals deserve good health care, but it's up to the owner to recognize the signs of illness and seek veterinary attention. One fairly common ailment often overlooked is bladder stones. The symptoms are clear, but when they're not recognized early enough, bladder stones can become unnecessarily painful and difficult to treat. Joining us now with more on this condition is veterinarian Sandy Jameson. So Sandy's brought in Susie, right? That's her name? What was Susie's problem?
Well, she had one of those problems with the bladder stone. She came into us about a month ago, and her problem was that she was dribbling urine all the time. She just couldn't seem to control herself. And there was a little bit of blood with it, which is fairly common with that sort of a problem.
Whoops, there she goes out of camera range.
Susie.
Come back here. Yeah.
Oops.
Okay. So those were the symptoms that the owner came to you with.
And they can be signs of many types of urinary problems. So when we first saw her, we didn't know what the problem was, but that was one of the things that we were suspecting. So the first thing that we do is a urinalysis. Well, I'm sorry. The first thing we do is check her all over. And when we checked her, we could feel there was a lump in her tummy, a fairly large lump. And we didn't know if that might be a tumor. Because she's 7 years old, it could have been a tumor. Or it could have been, you know, a stone. It could have been a polyp or something like that. So the first thing we did after that was a urinalysis. The urinalysis wasn't really clear. It told us there was a number of different things consistent with any one of those.
Right.
So then we took an x-ray. When we took the x-ray, we had a good idea of what her problem was.
Pretty obvious.
Yes, it's
wow,
very
it's
obvious.
huge.
Right in the center, just a little bit to the right there, you can see the stone. There's a smaller one as well. And we knew what the diagnosis was, that she had a bladder stone. Now in this case, because of her age and so on, the type of stone we knew can be treated in two different ways. There's a medical treatment for it, which involves changing her diet to a sort of diet that actually dissolves these stones. So we can change the diet, it acidifies the urine and causes her to urinate a lot, and this causes these stones to break down. Now the problem was that if Susie had a stone that was the size of that small one, then we could have used the diet. But Susie's stone was very large. And
very. Looked in the x-ray.
Well,
you've brought it in here, too.
I brought the stone along. So guess which way we chose. We took the surgical treatment. Now, let's see, have we got this up there?
Put it over here.
Okay, we'll
so
put
we
it right beside the can. Okay, it's a very large stone. And
so what did you do for that then?
So what we did, we knew that that would take about 6 months, and over that period of time, Susie would experience the discomfort of the stone, so we knew the best thing to do was to do surgery. So we took her into surgery and removed it. And even when I was in there doing the surgery, I couldn't believe the size of that stone. It was exactly the size of her bladder. So there was no room for any urine at all in that bladder. It was just going into the bladder, no room, and having to come out right away.
And I would guess causing her considerable discomfort.
A lot of discomfort, right.
Now, if the owner had recognized it earlier, would it have been possible the stone was smaller and could have been treated with the diet, as you said?
That's right.
And that's what this is, right?
Yeah, this diet here is it's a very new type of food that's out. It's called SD, which stands for stone diet, and it's designed to dissolve these stones. So that instead of having to go through a surgical procedure, we can just put her on this food and dissolve the stones.
How do you know then that how do stones start? How do dogs get them?
Well, there are a variety of causes, and some of them are caused by the dog themselves. They have a genetic predisposition to this. They may not have the right factors to inhibit the formation of stones. Sometimes the diet they're on causes a buildup of certain minerals that will lead to the problem. And there are still, to this day, factors that we don't know about.
Okay, a happy pooch.
Wag that tail, Susie.
Thanks very much, Sandy Jameson.
Thank you.
And Susie.